Welcome back everyone to our NECASafe Risk Focus Toolbox Talks series. My name's Manus and I'm the NECA Membership Manager for Sydney Metro. Off the back of our previously successful NECASafe Risk Focus Toolbox Talk on gravity hazards, today we're talking about a topic that's super important for every NECA member and their workforce, manual tasks. Joining us today is Cassie, one of our specialist in-house NECASafe advisors. Now, before we jump into today's topic with Cassie, I'd like to welcome Nathan and Jake here at TLE Monavale, from where we're broadcasting today. Hiya guys. So, Nathan, tell us a bit about TLE Monavale and this great location.
G'day Manus, and welcome to TLE Monavale and the NECA team. TLE Monavale, we service all of the peninsula, northern beaches. We carry a full range of electrical accessories, including all partners from NECA, including Schneider and NHP. We'd love to see any customer who's in the local area, and we're more than happy to service and look after your business. Thanks very much.
Thanks, Nathan. Don't forget, pop down to your local MMEM wholesaler, as they are NECA's only national wholesale partner. If you're in the northern beaches of Sydney, then TLE Monavale has all your electrical and communications needs. Now Cassie, given the serious nature of the topic, could you start by explaining why it's crucial for our members to stay informed about manual tasks?
So using the body to move or hold objects is just a part of the daily requirements of an electro-technology worker, from running electrical wiring, installing solar systems, air conditioners, as well as installing data racks. You really just can't avoid manual tasks. Certain manual tasks can lead to cuts, lacerations, and musculoskeletal disorders. In this Toolbox talk, we will highlight the significance of identifying and mitigating the hazards associated with dangerous physical tasks to prevent musculoskeletal disorders among employees, electro-technology workers, and your office workers alike.
Wow, I had no idea that manual tasks could be so potentially dangerous in everyday work environment. Now, you mentioned musculoskeletal disorders. Easy to say, right? Could you please explain what a musculoskeletal disorder is?
Sure. A musculoskeletal disorder, or MSD, is a condition that affects your body's musculoskeletal system, including your bones, muscles, nerves, and tendons. These disorders can happen suddenly or develop over time and don't include injuries from direct contact. An MSD covers a wide range like sprains, back injuries, joint problems, nerve compressions like carpal tunnel syndrome, damage from vibration, and chronic pain. They can be caused by wearing out body parts over time through repetitive use or from sudden injuries during activities. Essentially, MSDs can come from overuse, staying in one position too long, or from accident.
There you go. Musculoskeletal disorders sound pretty full on and very serious, right? Look, I must say, I do prefer saying the abbreviation MSD rather than musculoskeletal disorder. Next question, if I may. What then constitutes a hazardous manual task?
So a manual task is any activity requiring a person to lift, lower, push, pull, carry, move, hold, or restrain something. It's hazardous if it involves repetitive or sustained force, repetitive movement, so both of these need to be performed more than twice in a minute, high or sudden force, or awkward posture that is held for more than 30 seconds at a time, and exposure to vibration. These will apply direct stress to the body, resulting in an injury.
I must say, I didn't fully realise or appreciate what's involved for a manual task to become hazardous. With that in mind, what are some tips to make it easier to identify these hazards?
Great question, Manus. So, given the nature of work in our industry, electro-technology workers are at particular risk. Consultation and communication is key. So discuss if tasks are causing muscle fatigue or involve awkward positions or movement or cause any form of discomfort. It's important to look out for signs indicating potential issues, such as tasks where workers have to makeshift improvisations, like stacking mats or flattening cartons to stand on to avoid discomfort.
So, with consultation and communication being the key, as an example, if a particular hazardous manual task, such as, say, repetitive movement, was identified, how can we assess the associated risk?
So an easy way is to ask these 3 questions. Number 1, does the task involve repetitive movement, sustained awkward postures or forces? Now the risk is greatest when the postures and movements are extreme, so that's towards the end of the movement range, and when they feel uncomfortable for the worker. Another point is the longer the task is performed, the more hazardous it's likely to be. And as a general guideline, long duration will mean that the task is done for more than a total of 2 hours over a whole shift, or continuously for more than 30 minutes at a time. The second question, does the task involve high or sudden force? So high and sudden forces are commonly associated with loads that are unstable, unbalanced, or difficult to hold. And the third question, does the task involve exposure to vibration? The degree of risk increases as the duration of exposure increases and when the amplitude of vibration is high. So an example is when you're driving on rough roads and frequent prolonged use of hand power tools. So you are at risk if you've answered yes to any of those questions.
Great feedback, Cassie. So by asking those 3 simple questions, you can assess the risk associated with repetitive movement. Now, talking about the risks and hazards surrounding manual tasks, what should we be doing about these risks and hazards?
So always aim to eliminate the risk, or if that's not reasonably practicable, you must minimise the risk by substitution, isolation, engineering controls, and then administrative or PPE. Elimination could look like purchasing of equipment. You would consult your workers to ensure that an item is appropriate for the work being undertaken, compare what is used in similar workplaces, and review industry guidelines and trial equipment before purchasing if possible. Examples of minimising the risk could be through controlling the design layout of work areas, for example, the degree of reaching, twisting or bending, controlling the nature, size, weight, number of items being handled, and handheld tools should be light and well balanced, with the heaviest part of the tool behind the wrist, and power tools should produce minimal vibration. Controlling the work environment by keeping work areas clean, tidy, and free of clutter and obstacles to prevent workers adopting awkward postures and avoid the exertion required to reach over and around obstacles. And use administrative controls such as job rotation and implementing lifting procedures.
Wow, that sounds pretty full on and quite a lot involved in controlling hazardous manual tasks, right, Cassie?
Yeah, it can be, which is why it's important to provide training. So this should be provided during an induction into a new job and as part of ongoing manual task risk control programs.
Great stuff, and important to highlight that providing proper training, especially during induction for a new job or with a new employee, and setting the right safety foundations is critical for every business. Is there anything else that needs to be provided?
Well, yeah, there is. So once controls have been implemented, we need to ensure that they're being maintained. So you need to be carrying out regular inspections on tools and equipment and service in accordance with manufacturer's specifications. So poorly maintained or irregular service tools and equipment may increase the effort needed to use them. We also need to review these controls using methods such as consultation and field-based inspections. To make sure you're asking questions such as, have the control measures introduced new problems? Are workers actively involved in the risk management process? Have new work methods or new equipment reduced physical strain or difficulty? Have instruction and training provided workers on hazardous manual tasks and the implemented control measures been successful? So to make it a little bit easier for you, you can use the manual task field-based inspection, accessible via the member knowledge base.
Thanks, Cassie. Great insights, and thanks heaps for shedding light on the significant impact of manual tasks and the importance of comprehensive hazard identification, risk assessment, and controlled maintenance. To our NECA members and viewers looking on, remember that staying vigilant, conducting regular inspections, and fostering a culture of safety can significantly mitigate these risks.
To finish with a story, a young apprentice reported that an older electrician employed by one of our member businesses was experiencing mental health issues. The apprentice had noticed changes in the electrician's behaviour and informed the manager. He then contacted NECA for further assistance. And upon investigation, a NECASafe advisor discovered that the electrician was suffering from bad back and chronic pain. He felt his career was over and was distraught. Unsure of his next steps, he was hesitant to pursue workers' compensation, fearing it would negatively impact business. So after consultation with all stakeholders, it was determined that workers' compensation was the appropriate course of action to address his injury. Additionally, it was decided that finding a new job with a different company would be the best outcome for him. The electrician received the necessary treatment and, with the help of the rehab provider, secured a great new job at the local TLE wholesaler. He's happily working in a position that he knows well. Since then, he's recovered from his mental health issues.
Wow, Cassie, that real-life example of the electrician beautifully highlights the crucial role TLE played in offering a lifeline to an electrician in desperate need. Well done, TLE. This act of support underscores the vital impact businesses like TLE have on the industry, particularly through their contribution to these risk-focused toolbox talks, significantly enhancing workers' well-being. Being a NECA member offers a supportive network committed to the members' welfare. NECA's comprehensive support, from workers' compensation to job transition, demonstrates its dedication to professional standards and the well-being of electrical workers. Members can trust that they are part of a proactive, empathetic and solution-oriented community. Your team's safety should always be your first priority, and we hope these reminders encourage you to take manual tasks seriously.